Welcome, everyone. We'll be getting started in just a few moments. Hello, this is Angela Seifer. I'm the Executive Director of the National Digital Inclusion Alliance. We're going to get started in just a minute. We're just letting folks come into our virtual room. Hi, let's get started. I'm Angela Seifer. I'm the Executive Director of the National Digital Inclusion Alliance. This is our 9th and final webinar in our Net Inclusion series. I'm super excited about this today. Net Inclusion is usually an in-person event, right? Hopefully it will be in Portland 2022, mark your calendars. We'll put a link in the chat as to where you can get more information about that, save the date. So this year we did 9 webinars. Yes, it's been exhausting, and yes, we're glad this is wrapping up. You can find all the recordings for those on our website, just as this one also is being recorded, and you'll have access to that one tomorrow. For you to share around, because I'm sure you're going to hear lots of amazingness today. As with all of our webinars, we encourage chat conversation, get to know other community members in the chat. The Q&A, use the Q&A to ask our panelists questions. Go ahead and throw them in whenever it occurs to you. And then as our moderator, April, sees that it makes sense to wrap it in, she'll wrap it in, or she'll throw it in at the end. If we run out of time, we apologize, and we welcome you to contact any of the NDIA staff or the panelists if there are other questions that go unanswered. So I'm going to turn it over to April. Mims is our moderator extraordinaire today. April, thank you so much for doing this.
Thank you, Angela, and thank you to NDIA for the opportunity to moderate this panel with such distinguished panelists. I'm going to start today by introducing all of our panelists, including myself, and then I would love for each of our panelists to start by telling us a little bit more about your organization. Specifically, I would love to hear what your organization is doing to advance digital equity, and then we can jump into more specific questions about partnering with healthcare organizations. So April Mims. I am Senior Vice President at Hims and Hers, and I'm also one of the co-founders of the Telehealth Equity Coalition, which I'll talk a little bit more about during this panel, but would love to introduce our panel now. First, we have McLean Bryant Macklin. She's Director of Policy and Strategic Initiatives at Health Forward. Next, we have Diane Connery. She's Special Projects Librarian at Pottsboro, Texas Library. Next, we have Dr. Amy Schoen. She's Digital Health Equity Consultant at Public Health Innovators, LLC in Cleveland. And then last but not least, we have Shalitha Mitchell. She's Director at the Center for Innovation in Medical Professions, also with Cleveland State University School of Nursing. And so for each of our panelists, we'll start with you, McLean. Would love to start by hearing what your organization is doing to advance digital equity.
Sure. And I'll try to be brief. So my foundation, I work for a foundation focused on providing access to affordable and quality healthcare for folks that face significant barriers to health. And so we're a public health foundation. We have been very focused on the social determinants of health. And so find ourselves very focused on digital equity as that super social determinant. We have digital equity and telehealth equity woven all throughout our policy agenda and advocate for policy that will bring about greater equity in both of those realms. But we also have started grant making toward digital equity as well, and provided approximately $200,000 in the last year toward digital equity, and look forward to making greater investments in digital equity in the future.
Excellent. Next, we will move on to Diane. Diane, would love to hear what your organization is doing to advance digital equity.
A lot of people think about libraries as related to books, but in a rural area with real barriers to broadband, we do a lot of work with building infrastructure. We're neighborhood access stations. People come to the library to check out routers to take home to have home internet, and telehealth. We've now launched a telehealth program.
Thank you, Diane. Amy, would love to learn more about what your organization is doing to advance digital equity.
Sure. So until January, I was an academic at Case Western Reserve University School of Medicine and did a lot with mapping to look at the connections between health equity, digital inclusion, and health disparities. I now do full-time digital health equity consulting, helping healthcare systems improve equity in their digital engagement. And I also make connections with community organizations in healthcare. And I serve as the research director to the Telehealth Equity Coalition.
Thank you, Amy. And Shalita, would love to learn more about what your organization is doing to advance digital equity.
Hi, thank you, April. I am Shalita Mitchell. I just wanted to correct my my title. I am with the Cleveland State University in the School of Nursing, and I serve as the director, long name everybody, Cleveland Region Interprofessional Area Health Education Center, which is just AHEC for short. And with the AHEC program at CSU, I work with students in a variety of health professions, and I create meaningful experiences for students to gain community hours, such as sort of like clinicals in the community. And part of the work that we do with the students in health professions focus on digital equity, where the students actually volunteer in the community in digital literacy. But I'll get to that later on. In my other role here, I'm kind of wearing two hats, if I may, as I also serve as the board president for the Ashbury Senior Community Computer Center, ASC3 for short, located in the heart of the inner city, Cleveland.
Thank you, Shalita, and apologies for the organization mix up.
That's okay.
But now we're going to launch into talking to our panel a little bit more about partnering with health organizations. I don't think we need a lot of context for why this conversation is important in a post-pandemic world, but let's set the stage anyway. I think we're going to start broad and then we're going to go a little bit more narrow and focused. So to start with, would love to ask the question, and this one will be directed to you, Amy. You know, why is it important, and what are some of the largest barriers to healthcare and specifically digital care?
Sure. So we know traditionally that the biggest barriers to healthcare are money, whether people have insurance, but also whether they feel welcome and have been treated fairly by the healthcare system. So digital offers a lot of opportunities for overcoming some of those barriers, not the economic ones. In fact, the economic barriers exacerbate the digital barriers, because the same population, of course, that lack access to care also experience worse health outcomes and have less access to the internet. So you kind of got a perfect storm there of lack of access to healthcare, poor social factors that affect people's health, poor internet access. accentuating health disparities.
Absolutely. And it seems as if the lack of digital equity piled on top of the existing healthcare inequities is sort of creating the perfect storm. And so, Shalitha, this question is for you. My question for you is why is digital literacy, why is digital equity important when you're working in the healthcare system, especially with vulnerable communities?
This is really a loaded question, and it is so much my passion to be able to sit in this realm and be able to talk about these inequities as they affect our vulnerable populations. We all know that, a year and a half ago-ish, that the world stopped in person and it went virtual. And so when we work with marginalized populations, those who, your traditional social determinants of health, those with economic barriers, as Dr. Schoen mentioned, you have transportation barriers, educational barriers, social, etc. And then when you pile on digital inclusion and equity, now that's another barrier. It's so refreshing now that digital equity is considered a social determinant of health now, and even in some realms, a public health crisis. So, but when you have a population that is marginalized already, and then you have an issue like COVID, and then you have already a marginalized population further disenfranchised. And now what are they to do? And so you need the organizations, whether they're community organizations, to be able to say, okay, we're going to help to balance this four-legged stool. And we all know that the four-legged stool of digital inclusion, where you have your access to devices, quality devices, tech support, high-speed broadband, and of course, digital literacy skills. Our healthcare systems are in actually unique places where they can assist those marginalized populations by providing resources to their patients. And we actually have done some work in that area. I won't talk about that now because I know Dr. Schoen will talk about a partnership with Metro Health, who is doing just that, and some others in the greater Cleveland area. But in terms of community centers, community technology centers, even our libraries, in being able to connect with the leaders within these healthcare institutions and say, okay, what are we going to do? We know marginalized people are already lagging behind in use of digital literacy, high-speed broadband, but then when you add on telehealth, they're even further behind. So we definitely have to have the leadership in place to be able to say, you know what, let's partner, do what we can so that we can make a difference.
And look forward to learning more about the work that you and Amy are doing in this space. McLean, I want to turn to you because I know your organization does work around policy and telehealth. That's one of the many facets of what your organization does. I would love to learn more about how telehealth can potentially be a lifeline for underserved communities. We know that there are so many barriers out there, but I would love to hear more about what some of the positive aspects of it are, and also maybe what some of the barriers are to access.
Yeah, I love how you stress the word possibility, because, the inequities that pre-existed the pandemic, like Shalitha mentioned, have only been exacerbated by the pandemic. And it's all the same people that face these different barriers, no matter what the barrier is. And telehealth, telemedicine has the potential for decreasing some of those barriers, like, barriers to childcare or barriers to transportation that have prohibited certain populations from accessing, physical care at a doctor's office. And, with telehealth and with, broadband access and acumen comes the opportunity to do those virtual visits from home or from your desk at work or from some quiet place at your place of employment without having to travel great distances, 60 miles or so in some rural areas. And so there is a tremendous opportunity But, in the way of that opportunity is lack of digital access and broadband access. And so the two are just so inextricably intertwined that they have to be tackled simultaneously. Healthcare providers have to have top of mind that, their employees, their patients, the entire world around them face these barriers and think through how they can be part of the solution.
Absolutely. And I think one of the themes that we'll probably touch on over the next hour is telehealth as a double-edged sword, that it has the potential to both augment inequities, but also close the gap if done correctly. And I just wanted to use that moment to talk a little bit about the Telehealth Equity Coalition, which I'm a part of, NDIA is a part of, and other organizations that might be on the line. We were formed in February, and we were really focused on addressing many of the things that you mentioned, McLean. The fact that telehealth has this opportunity to provide flexibility, to provide a way to access care without transportation, and also a way to standardize care in many ways, to provide a transparent process where people who are going through a recorded telehealth visit, or if they have a transcript, you have that accountability, and also sourcing diverse providers. I don't know if we're going to really talk about provider diversity, but we certainly know that that can be a barrier to equitable telehealth or equitable healthcare, and that telehealth might provide a way to access specialists and more diverse providers that can represent patients. And so the Telehealth Equity Coalition was really formed on this premise that telehealth has so many opportunities, and yet these barriers that we're discussing exist. And so in order for us to truly see it realized for our most vulnerable populations, we have to work together in community and partnership. So I'm hoping that if there are other folks on the line, they'll be interested in joining, but that's just one of the many ways in which I know a lot of organizations are looking to address these issues. Amy, I want to turn to you because I know this is a passion of yours, having worked with you a little bit, is the concept of digital navigators and how digital navigators can be excellent partners to different health systems. So my first question is, what is a digital navigator?
Sure. So digital navigators is a concept that the National Digital Inclusion Alliance, of course, have done great work in really sort of building out and disseminating what is this model. And the idea is it's people who might be placed or be already employees of social service organizations, educational, library institutions, or digital inclusion organizations. They're people who are trained to help people get on the internet. We know that if you just tell somebody how they could get on the internet or where they might even get a free or low cost device or internet plan, that the likelihood that they follow through on that is very, very low. There are really big hurdles, like, for example, having to upload documentation to show that you qualify for a low-cost program, which of course, if you don't have internet or digital skills, you can't do. So that's one role for digital navigators. But another thing is they are experts in teaching people how to use digital tools. And, I think what we've seen in healthcare is prior to the pandemic, a healthcare provider might see a patient that's, been using a phone and say, oh, hey, you've got a phone. You just had this lab result. Let me help you download, my chart onto your phone so you can check your lab result. Well, that's a terrible use of a physician's time, and physicians aren't very good at it. It's, helping someone to use it. So it's really super stressful for everyone. So digital navigators understand the lived experience of people who come from a background with little digital access and skills, and they have a lot more credibility with the population that they're trying to serve.
Thank you, Amy. And I know there's a link in the chat there. If you would like more information about the digital navigator model, it certainly seems like it's going to be an innovative way and a very disruptive way, in a positive way, to kind of break through some of these barriers to getting folks online when they need it the most. Diane, I want to turn to you and bring you into the conversation. I know your organization is doing incredible work to make digital healthcare more accessible, especially to rural communities. So my first question for you is, Just in general, what role do community organizations like yours play in increasing digital literacy and equity?
Okay. And I will start this by saying I'm still surprised I live in a rural community. My whole life I lived in large cities, San Francisco, Atlanta, Dallas. And that is what moving to a rural community 11 years ago is what brought me to this digital equity work, because I didn't understand what living in a rural community meant. As an aside, I thought everybody in America had decent water coming out of their taps, and it's not true in some rural communities. And so going back to that word opportunity, I'm in a library. I'm actually in our telehealth room now. And it used to be a post office. It's about a 2,500 square foot building, basically one big room. And we are much more focused on internet access for our community than books. Most people think of libraries as about books, but we do a lot because the infrastructure just doesn't exist in many parts of our community. So for some people, it's a financial issue. For some people, it's the only option is satellite. And so Texas being kind of the Wild West in many ways, when the pandemic started, so many people needed access to the internet that we stayed open. So we have been open throughout the past year, helping people get the access to resources they needed. And we started getting some calls. The first woman who called me had an MRI shortly before the pandemic started, and the neurologist wanted to talk to her about the results, but she has COPD. He did not want her to risk coming into the office, so he asked if she could do it online, and she didn't have access at home, so she asked to come into the library. I set her up in the director's office, the only private space. So then we started getting, a few one-offs like that of people whose doctors had requested it of them. And about that time, a National Library of Medicine grant for $20,000 became available, and we were awarded that COVID outreach grant to launch a telehealth room. And I was able to wrap my head around the library side of it, these one-offs. Libraries are big in privacy, so that was a thing we did well. We converted a junk room, happened to have an outdoor entrance into this telehealth room, because another factor, even if people had access to the internet and access to hardware, they may not have the digital skills to connect. And B, even if they had all those things, they may not have a private space in their home to access an appointment. So a library serves all those things. And we have digital skills that are needed to help people connect. So many people we get in here will tell us they've never touched a computer before. And so we created this room, and then we connected with healthcare providers. And so 2 days a week, the people can come in here and connect with those healthcare providers. Appointments are made through them. They handle all the pre-screening. If people need access to the internet, they can come in here in advance of the actual appointment to complete the paperwork, and we can help them with that. And then as library staff, we just assist them in as much as they need to get logged on and connected, and then we'll leave them in this private space to have their appointment. And libraries are they're neutral spaces. So if people are having behavioral health appointments, it's safer, quote unquote, to have their car parked at the library than maybe in front of a healthcare provider. But particularly rural communities, transportation is an issue for people. There are no healthcare providers in our community. The nearest are about 30 minutes away. And so when you look at some of the statistics, people in rural communities have worse health outcomes because they'll put off going to see a provider. And we have no public transportation in our community or ride sharing, anything like that. But our library happens to be in a section of town that's walkable for many people who would need to access our telehealth room. So word is spreading among libraries. So there's a lot of opportunity out there.
Thank you, Diane. I mean, Pottsboro Library, it's such a model for so many other libraries and organizations across the country. So hopefully we can include that information in the chat as well, because I imagine you're going to get some follow-up questions about, you know, how you as a library representative can set up that type of structure, you know, especially the part about finding a safe and quiet space. It's something that we really don't think about, but it's so critical to telehealth. So thank you for sharing that.
Sure.
Amy, so I'm going to turn to you now. We're going to talk a little bit about broadband and hardware access, which this group, if you're listening in on this discussion and you're part of NDIA, that you're no stranger to this conversation, but we know, of course, it has an impact on telehealth access. So, and so much so, in fact, that it's been called a super social determinant of health, which Shalitha, you touched on earlier. So, you know, just from a general level, Amy, you know, I don't know if you have any specific examples, but why is internet and broadband access a super social determinant of health? Even outside of telehealth, why does it impact your health to not have access to the internet?
Sure. So as I mentioned earlier, we know that there are huge health disparities, right? In Cleveland, people who live in some areas live 20 years longer than people who live in other areas. And it happens to be that the same areas where people have poor health outcomes, have poor access to healthcare, but also the much more important factors that actually affect their health, and that is income, poverty, the quality of education, whether there are jobs in neighborhoods. So, you know, your zip code, they say your zip code has more of an influence on your health than your genetic code, and also than your use of healthcare. So, you know, the people who live in neighborhoods that have, where people have poor health outcomes also can't be healthy because there are no jobs, they, you know, can't earn income. There isn't access to healthy food and safe places to engage in physical activity and the like. And so increasingly, having the internet is essential to doing all of those things that could then affect your health. Now, what's really interesting about the nexus with healthcare is that health systems are now feeling a financial impact because of the health of their people. It used to be a health system got paid for delivering care, whether or not it made any difference. And one of the changes kind of behind the scenes of the Affordable Care Act is that health systems now are increasingly paid for keeping a population of people healthy. And so that's why healthcare has kind of discovered the social determinants of health. And health systems are now routinely screening their patients for their social determinants of health and then referring them to community organizations to address, you know, if they need money to pay their rent or their utility bill or healthy food. So those of us from the digital inclusion community are trying to push the health system to say, well, as long as you're screening your patients for all those other things, why don't you also screen them for their digital skills, digital devices, hardware access, and add to the list of places in the community that you refer people, NDIA affiliates, digital inclusion organizations where people can get those things. So, but it's really been a learning curve for healthcare to really get why, you know, even though digital directly impacts ability to get healthcare, the indirect connection to social determinants of health.
Thank you, Amy. McLean and Shalit, I want to bring you guys back into the conversation. We've talked a little bit about how lack of access to internet, broadband impacts both your ability to access telehealth and also, it's a social determinant of health. And we've talked to Diane a little bit about how libraries are playing such a critical role. I would almost argue they're quasi healthcare organizations at this point, with all of the great work that they're doing. But to speak more broadly to the role that healthcare organizations can play and kind of get to the heart of this conversation, I wanted to ask you more broadly, what role can healthcare organizations play, in advancing digital health and telehealth, from health systems, health clinics, telehealth companies? Would love your perspectives here. We'll start with you, Shalita, and then next, McLean. Shalita, you're on mute.
Only a year and a half into Zooming and you still forget to go off mute. But in terms of healthcare organizations, with respect to telehealth and empowering the community to be able to access and utilize this telehealth systems, we have to make sure that the healthcare organizations really partner with community-based organizations that really have their sort of like the foot soldiers, their feet to the ground. So I don't think that the healthcare organizations can operate in silos when they want to really try and reach the vulnerable populations. To me, that is certainly key. Whether you have your large systems or neighborhood clinics, still being able to say, well, when patients come in, when they often already have a mistrust of the healthcare system, to now you want to tell them, okay, so your next visit, we're going to meet via telephone or on a computer or a web-based platform. What's a web-based platform? How do I do that? Is my information safe? Is this a secure process? I would like to come out and see people. So you're met with so many issues like that. Then if the patient still is unclear, what about that organization that they may go to and have their senior lunches at? Or, they go and play the neighborhood bingo, but really creating a brand that shows trust, empathy, and care. When you put all of those together and you package this to these vulnerable people and say, this is how you can do it, and show them and walk them through it. Maybe the healthcare system can't take the time, and Amy said earlier, it's not a good use of a physician's time to be able to sit down and walk an individual through it. However, if that hospital, that system either has either a digital navigator on site, or if they are partnering with organizations like Diane's library to be able to do that, and these people can really have the time to go through. And I'm really approaching this from a community standpoint, from seniors, because I do so much work with seniors, but we know that minority seniors, and then you factor in the other SDOHs, income, et cetera, lag furthest behind in some of these digital platforms, and especially telehealth. So you needing to be able to really take the time with the individuals and walk them through it. Healthcare systems can really provide a base for in enhancing the amount of the population that actually accesses telehealth. But again, it's about partnering with individuals they trust.
Thank you, Shalita. McLean, would love your perspective.
Yeah, everything Shalita said was just so resonant with me, because, we cannot craft solutions as healthcare organizations without the input and just, the greater involvement of those that and power sharing with those that are impacted by the divide, whether it's, the telehealth equity or digital equity. There are some great examples of what healthcare organizations are already doing. The Healthcare Anchor Network has been tracking what health systems are doing in particular in terms of infrastructure investments that are being made. Some hospitals are putting antenna on their buildings, and a lot of the hospitals, as you know, are located in low-income areas. And so providing low-cost internet to the communities and neighborhoods around them is a great example of what a healthcare organization could do. Embedding digital equity training into the larger trainings that hospitals do for their employees so that they know what to look for and what to problem solve around. And just being sensitive to the barriers that their own employees face and their potential employees face to digital equity as they're looking to grow their workforce and make their workforces more diverse. What we have done as a public health foundation is to fully accept digital access is that super social determinant. And so we see the opportunity to bring about greater digital equity in really all the work that we do. But more pointedly, last year, we made a grant to an organization that is going to work with our existing community health worker training educational organizations to ensure that these community health workers are being trained on digital equity, and so they can recognize those that don't have access or the acumen, as well as to direct those people to the resources that are available to them to help them and to help them to navigate telehealth within their own provider systems. So there are a variety of things that can be done. The first step, though, I think, is for healthcare organizations to and providers. The first step for providers, rather, is for them to adopt, these tools in telehealth, and as they're doing so, keep digital equity in mind.
Thank you, McLean. I also heard your co-host in the background. He was agreeing with everything. No, I really appreciate that feedback. And what I'm hearing, McLean, is you saying that, in many ways, it's not about healthcare. Digital health is health at this point. At this point, there is an expectation of healthcare organizations to be either providing those resources or partnering with the right organizations to make sure that their populations understand how to use this technology, because it's so important to our quality of life and quality of care. And Shalitha, I loved your feedback as well from working with seniors. And one of the things that strikes me is it's really about trust and respect, that's so much a part of the work that you do and the partnerships that you forge in the space. So thank you for that feedback. Diane, wanted to circle back with you and kind of check your temperature on this question, which is, what is the current state of partnerships between health systems and digital inclusion organizations? And I think the underlying question is, how are we doing here? What's the status?
One of the issues that comes to mind when you ask that question is I think a lot of healthcare providers may not have even thought of libraries as an option. So as the word gets out, I think there'll be more partnerships. Rural hospitals nationwide, a lot of rural hospitals are closing. And at the same time, healthcare providers, like I have a partnership with the University of North Texas Health Science Center. One of their, part of their mission is to reach rural areas. So I think, and just to give you frame of reference, that they're in Fort Worth, it's about a 2-hour drive from Pottsboro. They've been great about providing me the resources that we would not have the budget nor the staff for, marketing, for example, because a lot of times libraries aren't the best at marketing. And so those healthcare systems have been able to use their resources to help us get the word out. So on that hand, I think healthcare providers are very open to looking for community partners. I need to do some work, to be honest, connecting with the closer that I mentioned, our hospital's about 30 minutes away. And I have not been able to create a partnership with those providers. And I don't know, maybe I'm reading too much into this, but I'm wondering in that case, if they feel like my partnership with the Health Science Center is in some way competition for them. And so that's an area I need to explore and do some relationship building with. But we've also seen behavioral health as a real need. And as soon as I reached out to an organization, they were very, very much open to it.
Quick follow-up for you, which is, and you sort of started speaking to this, how can we encourage more partnerships and collaboration? You mentioned the potential perceived competition. Is there a way for us to work through that?
Well, I don't have all the answers. I have more questions than answers, but I think they'll put in the chat. We're just recently established a community of practice. As I have been getting calls from around the country, I'm hearing interesting partnerships like Dayton, Ohio has some partnerships with healthcare providers. I got a call from Idaho. Their state library had been approached by a health provider, an insurance foundation. The insurance foundation approached the state library and said, "We have money. How can we get into your library?" So I think part of it is just getting the word out that we're open to it. And part of that, when I initially started approaching other libraries, the pushback I got is the immediate thought from libraries is we do not want to be encouraging people with contagious diseases to come into the library. And I usually fly by the seat of my pants, but I can tell you, working with these healthcare providers who come up with 5-page disinfection protocols and the logistics, that's not a concern at all to me at this point. So I think all of those things can be resolved. And one of my big takeaways from the pandemic is there are these national organizations and healthcare providers, big time systems that want to reach, at least in my case, rural communities. They need us. A lot of times I think rural libraries feel a little bit like second-class citizens or something like, oh, we're not as good as big city libraries. But we are the public-facing entity that can do the real work. And so I think just making ourselves available and the interest known through different organizations will encourage more partnerships.
Thank you, Diane. And if folks have questions for Diane or any of the panelists, please feel free to drop them in the chat. Especially getting the word out to other rural libraries about the importance role that they can play, I think will be so important. And so I hope there are folks listening on the line and they'll be able to get in touch with you and learn more how they can replicate some of the work that you've done. Shalitha, I know you had a follow-up comment really based on my question about how healthcare organizations can play a better role in promoting digital equity. So I want to turn it over to you.
Okay, thank you. Yeah, my follow-up was to McLean when she mentioned community health workers. And I'm so glad that you mentioned that in some work you all are doing there, because we also really value our community health workers. We have a CHW program, a couple of CHW programs here with respective colleges and universities here. And then being able to actually add that digital literacy piece into what they already teach, that curriculum. Like Amy has said, training CHWs to do screenings for digital literacy. And so any areas that also have either community health worker programs or anything similar, those are certainly valuable tools to help increase the awareness around digital equity, because they're already out there doing the work. Typically, our community health workers are in different areas, navigating the neighborhoods where people may not necessarily typically navigate. And so that is certainly a valuable tool to be able to do enhanced digital equity work. That's it.
Thank you, Shalita. We have time for a few more questions if our panel can stay on the line. And one question that I had that actually came up as we were prepping for this conversation, we've had a great discussion about the right things to do. And certainly, the organizations on the phone are doing the right things to partner. But I wonder if it would be productive to also explore what can go wrong with a partnership so that we can learn from some of these mistakes. So Diane, I actually want to pose this to you. If you have any thoughts on what can go wrong with respect to partnerships from your experience. And Amy, I want to circle back with you on that question as well, so you can begin thinking about it.
Luckily, I have not had this issue, but I have talked to others in a partnership. The phrase was something like being collaborated on instead of collaborated with. The imbalance of power in a partnership. And so I think that can be an issue. I will say that I guess I'm so excited about the whole thing that I don't let myself be pushed around. It's like it's so great. There is room for all of us in here, but we do, being with a health science center, we signed a formal memorandum of understanding. And so everything was clear in the beginning, whose role was what. And I will say in my case, Health Science Center has gone above and beyond any expectation that I had. We have at our library, it's called a library of things. So people check out non-traditional items like bicycles and carpet cleaners and tools. And through the healthcare provider, they've provided us with durable medical equipment so people can check out a wheelchair, that sort of thing. And then a lot of training because just because you have library experience doesn't mean that you're comfortable with doing, a health reference question. And I would say, don't tell my mom this, but my mom is 90 and she is great on the computer, but she'll go to a doctor. He will prescribe some medication. She comes home and Googles it, and it'll say 1 in 4 million people developed polka dots, and then she won't take the medicine. She'll just say, that person doesn't know what they're talking about. I'm not going to do that. So that's, I think, one area a digital navigator or library would be helpful in terms of we have the training after the appointment. If people have more questions, we can direct them to Medline Plus. I've gotten training through the Medical Library Association and just recognizing authoritative resources so that we can go that next step. So our partners have provided a lot of printed materials and then helped us with the icons to put on our desktops of where people need to go to seek more information.
Thank you, Diane. And I've written down that phrase, being collaborated on. I think that's so important, especially for those of us in the private sector to remember. Very important. Appreciate that. Amy, turning to you.
Yeah.
What can go wrong in a partnership?
Well, first of all, kudos to Diane. Those were just great strategies and tips. So I think the things that I see most often are the following. Number one, an organization coming in with their agenda and not being sensitive to what the agenda is of the community organization that they want to partner with. So you really need to look for the win-win. That's number one. Number two is you've got to think about sustainability from the very get-go, because too many times, someone comes in with a small grant or funding, short-term funding, they get everybody geared up and excited, and then the funding's gone and the programs get put, and it leaves the community organization worse off because they've raised expectations. Number three is related to that kind of power imbalance. I think that there needs to be great sensitivity by the more powerful organization to empowering the other organization to be a partner. So there's a tradition called community-based participatory research, where you can train a layperson from a community organization to, be kind of a research partner or what have you, but also the need to pay people from the community to do whatever it is you're asking them to do, taking time off work to participate in an advisory board or to, give their feedback. They need to be paid to do that, and they need to be paid a meaningful amount of money.
Thank you, Amy. Shalita, I know you wanted to speak to this question as well. And then after this, we'll do a wrap up where I ask each of you for some final words and advice on how to increase digital equity, digital healthcare tools, and partnerships with health organizations. And McLean, I'll start with you on that. So Shalita, you have the floor.
Thank you. Yeah, I wanted to speak to partnerships, and I know we're talking about partnering with healthcare organizations, but also other organizations within your community that you might not necessarily think about partnering with. And I'd like to just talk about a multi-layer partnership that is going on here in Cleveland with the Ashbury Center, and then Cleveland State University, AHEC, where I also work. And then as a response to COVID, a bit over a year ago, I was able to secure funding for a community-based program that we considered a response to COVID. And the grant, I was able to secure that through my AHEC. And then I partnered with the community org at the Ashbury Center for what we call the DAP, DAP, Digital Aviator Program. And so, and I'll do my 1 minute wrap up in this too. So then, so I could take an extra minute. So the DAP, the DAP program, Digital Aviator Program, where the goal is to teach seniors to become their own pilots in their technical and digital world. And so the program was created for 6-week modules. The classes would meet twice per week, 2 hours each. And then the first part would be in person, first 3 weeks, and then the last 3 weeks would be virtual. So we would teach the seniors how to go online. Some of that might have been a bit overly ambitious. Sometimes we wound up doing virtual in person, but they still learned how to go online. If participants did not have devices, they could borrow Chromebook. They could also borrow Wi-Fi hotspots throughout the duration of the program. And then once they completed, then they could earn a voucher with another partner, PCs for People. I think we all heard of PCs for People, where they could get a full desktop unit with their voucher. We also will partner with our local public housing authority, CMHA, Cuyahoga Metropolitan Housing Authority, to focus on senior residences. So there was already a captive audience, and still 95% of the 125 people reached had never touched a computer, thereby saying, this need is so serious. But the other part of the partnership was, part of the program was health literacy and telehealth. So they underwent a telehealth session, a mock telehealth presentation, and they participated in mock telehealth. However, the students from Cleveland State were recruited to serve as digital health coaches. I trained them to conduct the telehealth programs, and the digital health coaches were assigned to the different digital health literacy classes to help both virtually and in person. So there was a wonderful multi-layer partnership where individuals were able to say, okay, yeah, I'm excited. I had hoped that, 100% of the participants were going to be ready for telehealth afterwards, but you still found some of the trust issues, and those are real and those exist. So you just have to be patient and continue to brand and keep the word out, because ultimately they're listening, but they just may not be ready to take that step right when you want them to take the step.
Thank you, Shalita.
You're welcome.
Very sage advice. Building the trust is so important, that foundation of respect as well. So now we're going to turn to wrapping up. The hour has flown by. We've learned so much. McLean, I want to turn to you. Do you have any final words and thoughts for how we can better partner with healthcare organizations to increase access to digital health and telehealth?
Yeah, we're sort of uniquely positioned being a foundation. We've got the power of the purse. And so we wield some influence because of that. I think that the opportunity for partnership exists strongly in the advocacy space, but would have to start with some conversation to figure out where there are areas of alignment, and then to jointly go about advocacy, which is strengthen those advocacy efforts to have, a variety of different organizations representing different factions at the table to advocate for these issues. But I would just, look for whatever your mechanism for influence exists, and use that to, get the door open and hopefully forge, an opportunity for partnership.
Thank you, McLean. Next, we'll turn to Diane for some final words.
Thank you. Yes, I did want to jump on what Amy had said about related to funding, because that is an issue, and I haven't come to any solution for it. But going forward, federal money is flowing right now, tons of grants. It's not an issue right now, but many times in the past, libraries have been sort of, I guess you would call it an unfunded mandate, that the government services have gone online and people are told just to go to the library, yet libraries don't get additional funding to take on this new work. And that's libraries are all about that. At the same time, I'm trying to picture what this will look like 5 years from now. If the I don't want to see the healthcare providers making all the money on it, and then the libraries not getting any piece of that to help with staffing. So I want to explore some possibilities of what that would look like. In the meantime, I am working primarily with one of my professors from my alma mater, Texas Women's University, to come up with training of and specifically we're looking in Texas, what do rural library staff what training do they need to be comfortable taking on this role, so that it can be something that's done well. And there are examples to choose from. A lot of my early work was based on Veterans Administration. Their Atlas program in very remote areas is ahead of what we've done. So again, the community of practice, I'm hoping we can share ideas in there so we're not all working in silos. And I believe if they haven't already, they're going to put in the chat. It's a 1 minute video of what our program looks like here at the Pottsboro Library. So thanks for having me, and I hope people will reach out if they have questions.
Thank you, Diane. Amy, you get the final word from our panels.
Okay, thanks so much. So I think the first thing is that healthcare needs to understand that teaching somebody to do digital health is adult basic digital skill education. That's different from health education. It's not like teaching somebody how to use an asthma inhaler. And so there needs to be an appreciation for the whole sort of pedagogy side. There's a group called the Open Door Collaborative that has some great resources on how to do adult basic education, but also libraries have that as well. Secondly is for the digital inclusion groups wondering how to connect with healthcare. You should look at the Office of Patient Experience because they're looking to improve patient satisfaction scores because they get money from that. Patients love digital engagement. Look to the population health groups because they're trying to get people to deal with, referred to address social determinants of health. And finally, help desks, the telehealth help desk, the MyChart patient portal help desk. Right now, they generally say, sorry, if a patient calls and their internet's shaky or they don't know how to use the device, sorry, can't help you with that. Well, this digital inclusion community could create a taxonomy of digital needs and templates of answers, and then healthcare help desks could use that. So actually helping patients with their digital barriers.
Thank you, Amy. So many great examples and so many wonderful things happening with all of these organizations that our panelists represent. It also, as we know, as you summarized, Amy, we have a long way to go. And so hopefully this panel was useful in providing some sage advice, some ideas, and there's also some great information in the chat. So now I think we're done with our panel. The hour flew by. Thank you so much to the panelists. I really enjoyed being able to moderate this discussion, and I know the discussion will continue. And now I will turn it over to Angela for some final thank yous and sponsorship recognition.
That was awesome. Thank you, April. Thank you, panelists. In the digital inclusion space, we are constantly getting this question about the impact on health, and having the Telehealth Equity Coalition exist now is awesome. I believe we did we share in the chat on how to find information on the Telehealth Equity Coalition? If not, somebody's going to throw that in the chat right away for our attendees because it's an awesome resource for those. In fact, I saw Marion in Nashville posted something and I was like, we got to connect Marion with April and Amy. So as NDIA learns of new digital inclusion programs on the ground doing telehealth equity work, we continuously point them to our friends who are organizing this, and we think that's incredible. So big thanks to everyone for being here. This has been recorded, so if you want to share it tomorrow, it'll be posted tomorrow. And thank you to our sponsors, of course, for making this all possible. And this is our last one. And not that I don't want to see you all again, but yeah, hooray, we made through 9 of these. And we will see you all in Portland in February, which will be awesome. Okay, thank you and have a great Wednesday.
Take care.
Bye.